You know, thyroid is really the conductor of the symphony of the body. So if you don't get thyroid optimal in a patient, not just normal, but optimal, the patient will never be as healthy as they could be. The patient makes 4 different types of hormone that are thyroid. T1 and T2, which are still experimental, but also T3 and T4. And when we look at the earliest signs and symptoms of low thyroid function, they may occur before the patient's lab is abnormal. So a lot of different signs and symptoms. It would be very boring if I stood up here and read them. But I wanted to include the majority of them for you. I'd like to point out some that we don't usually talk about. Headaches, including migraine headaches. Brittle, ridged, striated, thickened nails, rough skin, fluid retention, and even menstrual irregularities can be thyroid related. When we look at hypothyroidism, it can be poor circulation, nails that are easily broken. We talk about biotin being great for hair and nails, and it is, but we need to also look at thyroid. How about anxiety and panic attacks? Honestly, no one is born with a Paxil deficiency, right? Why do they have anxiety? Why are they having a panic attack? We want to look at the cause of the problem, and that's really what we do in an anti-aging metabolic approach. When it comes to patients, it really comes down to 3 things: vision, memory, and mobility. But that's all governed by thyroid, particularly when it comes to memory. Decreased memory, inability to concentrate can be signs of hypothyroidism. Decreased sexual interest. We talk about for men, testosterone, for women, estrogen, testosterone, progesterone, so she can sleep. But it's all governed by thyroid. You just heard Jim LaValle talk about cortisol. If the patient's cortisol is not normal, they really won't have sexual interest because the body literally turns off sexual interest. Women tend to miscarry. Men have abnormal motility and number of sperm, and so the body dysregulates. But again, all governed by thyroid. When we look at the other things, insomnia. You heard how important insomnia is because you have to have good sleep hygiene in your patients. If the patient's not sleeping, insulin really does go up. The patient is hypothyroid, they can have low blood pressure, agitation, irritability, yellowish discoloration of the skin because there's an inability to convert beta-carotene into vitamin A. Now, most of you, when you think of muscle cramps, what do you all think of? What do you think of with muscle cramps? What are you going to look at? Magnesium, right? What else? Somebody said calcium. Somebody said iron. All of those things, but don't forget to look at the thyroid because the patient could be hypothyroid. Even carpal tunnel syndrome. One of my best friends is Dr. Rick Singer, who is a premier hand surgeon. He is one of the world's best. And I was talking to him about carpal tunnel syndrome and what happens with thyroid. He admits to me he really does less surgery now for carpal tunnel syndrome because he's looking to see if the patient's hypothyroid first. How about sleep apnea? It's great to send the patient to the sleep specialist, and we should, and look at CPAP, etc. But we need to think thyroid. One of the worst flights I've ever had, because people usually ask me where I live. And my patients are in Michigan, and I teach at the Morsani College of Medicine in Tampa. So I really live on Delta Airlines. But one of the worst flights I ever had in my entire life was a gentleman sitting next to me with sleep apnea, and I sat there for 4.5 hours. And don't you just want to do this? Don't you want to just take and say, hi, here's my card. You have sleep apnea and you probably need your thyroid checked. You do, because you can see this in people.